Hello, I'm Mark Cattral. I'm a transplant surgeon in Toronto, and I'm here today to share our story about the collaboration that we've had with Astellas Canada, which has played an instrumental and key role in the development of our living donor liver transplant program at Toronto General Hospital and at Hospital for Sick Children. Astellas also played a key role in the development of preceptorship program, which enabled transplant surgeons from all across Canada to travel to Kyoto, Japan, and to witness their living donor liver transplant program. Well, I arranged a trip to Kyoto back in 1996. At that time, the program in Kyoto was the leader in the field in living donor liver transplantation, and it seemed to be the natural place for us to go. So Dr. Greg and I went to Kyoto in, I think it was about April 1996, and we spent 10 days there. And while we were there, we saw 3 living donor liver transplants. We were very impressed by their program. We were impressed by their meticulousness and their excellent results. I took extensive notes while I was there. And shortly after we returned to Toronto, we did our first living donor liver transplant. Dr. Greg and myself did the donor surgery, and then I went over and helped Dr. Superina do the transplant in the child. The transplant was successful, and the child continues to do well. Well, not a child anymore, but as a young adult has continued to do well since then. In 1999, Dr. David Grant joined our program, and we began to have discussions about starting an adult living donor liver transplant program. In April 2000, we did our first adult living donor liver transplant. And following that year, we did 7 more. So altogether in 2000, we did 8. So that was the beginning of the program. Well, we didn't know it at the time, but our trip to Kyoto served as a model for the rest of the country. And with Astellas' help, and in particular sponsorship, it enabled surgeons from all across the country to travel to Kyoto and witness their techniques. And I believe it was fundamentally important for the development of living donor liver transplantation across the country. I know Dr. David Grant, as well as my other colleague, Dr. Ian McGilvey, traveled there. And so essentially we were all on the same page of how to do living donor liver transplants at a high level. We have all been very appreciative of Astellas' ongoing support and partnership for the programs at Toronto General Hospital and Hospital for Sick Children. Well, since those early days, the living donor liver transplant program has evolved into being a key component of our program at Toronto General Hospital and Hospital for Sick Children. We currently do 80 to 90 living donor liver transplants each year. They account for about 1/3 of our adult transplants and 80% of our pediatric transplants. To date, we've done almost 1,400 living donor liver transplants, and that is the largest experience in the Western world. We also have a unique anonymous living donor liver transplant program. Almost 150 anonymous living donors have been done here at Toronto General Hospital. Yes, I'd like to say I'm very happy to share this story about living donor liver transplants to those who are relatively new to transplantation. I'd have to say I've been very fortunate in my career. I started back in the 1980s with islet transplantation and been involved with various aspects of abdominal transplantation over those years. I witnessed numerous changes with immunosuppressive therapy, preservation solutions, surgical techniques. Perhaps most importantly, we've seen better outcomes in all of our recipients. So the field has evolved enormously over the last 30 years, and I expect it will continue to do so over the next 30 years. As a final word, I'd like to express my appreciation and support for Astellas. They've been an excellent corporate sponsor for our program, and even for myself and my research program.